Psoriasis, a word that carries the weight of both science and suffering. A chronic autoimmune disease where the immune system turns against the very skin it is meant to protect. It is not contagious, but it is relentless, reshaping skin, joints, and even the inner workings of the immune system. It often begins where the world sees us first: the elbows, the knees, the scalp, the trunk. Raised, red, scaly plaques that itch, burn, and bleed. For some, it's mild irritation. For others, it consumes their daily life. Plaque psoriasis is the most common subtype. Round or flat plaques with a pink base overlaid by silvery white scales. They itch, they flake, they sting. They remind us that the skin is not just a barrier, it is an organ under siege. Guttate psoriasis appears suddenly, often after a strep throat infection. Small red papules spread like stars across the skin, a visual echo of the immune system's overreaction. In pustular psoriasis, the body produces sterile pustules, white blisters on angry red skin. In its generalized form, patients can develop fever, fatigue, and weakness so severe it becomes a medical emergency. Localized forms scar the palms, soles, or fingertips, sometimes even eating into the bone. Erythrodermic psoriasis is the rarest and most dangerous form. It covers nearly the entire body: redness, peeling, heat. Patients struggle to regulate temperature, balance fluids, and fight off infection. It is not just skin disease, it is systemic crisis. Nearly 1/3 of psoriasis patients develop psoriatic arthritis. Fingers swell like sausages, knees stiffen, the spine aches. Pain makes movement heavy, even disabling. For some, the arthritis appears before the skin changes, creating a diagnostic puzzle. Up to 90% of patients with psoriatic arthritis also see changes in their nails. Pitting, yellow-red, oil drop spots, thickening, loosening, and crumbling. Each fingertip tells a story of inflammation beneath the surface. Psoriasis has a genetic fingerprint. Over 60 susceptibility regions have been identified, with HLA-CW6 strongly tied to early-onset disease. Yet genes alone are not destiny. Environmental sparks ignite the fire. Stress, smoking, infection, even physical trauma, known as the Kobner phenomenon, can trigger flare-ups. Curiously, while smoking increases psoriasis risk, it may paradoxically reduce the chance of developing psoriatic arthritis. The relationship is anything but simple. At the cellular level, psoriasis is driven by the immune system. Antigen-presenting cells activate T cells, which migrate into the skin, releasing cytokines that drive keratinocyte hyperproliferation. This creates a feedback loop of inflammation, scale, and redness, a storm that refuses to quiet. Diagnosis rests largely in the eyes of an experienced dermatologist. Plaques, papules, and scaling often tell the story. But psoriasis mimics and is mimicked by eczema, fungal infections, and even rare cancers. When uncertain, biopsies reveal its microscopic hallmarks: clubbed epidermal projections, epidermal thickening, and persistent inflammatory cells. Under the microscope, psoriatic skin looks unmistakable: immature skin cells that never fully mature, CD8 plus T cells filling the epidermis, CD4 plus T cells in the dermis, a skin battlefield under perpetual siege. But psoriasis is not just skin disease, it is systemic. The inflammation spreads like ripples through the body, touching the heart, the brain, and the metabolism. People with psoriasis face over double the risk of cardiovascular complications, heart attacks, strokes, inflamed arteries. Driven by what scientists call the psoriatic march, a cascade of systemic inflammation. Depression affects up to 55% of patients. The stigma of visible lesions can isolate, but inflammation itself may also alter brain chemistry, linking chronic immune activity to mood disorders. Type 2 diabetes risk increases by nearly 50%. The genetic link lies in inflammatory pathways shared between both conditions, especially NF-κB. Psoriasis is not only skin deep, it is immune deep. Everyday life is shaped by psoriasis. Clothing choices, social interactions, even sleep. It is more than cosmetic. It is a chronic burden affecting identity, relationships, and opportunities. Understanding the roots of psoriasis, in genes, in immunity, in systemic health, opens doors to better therapies. The story of psoriasis is not just about plaques. It is about pathways, patience, and progress.